movement earlier. Now let's come towards the etiology and pathophysiology of the angina. So now I will explain here the atherosclerosis. This is the very basics. If you know about the atherosclerosis, you will come to know about the entire concept of angina. Okay, wait a second. Before moving towards the atherosclerosis, let me make you people understand about this particular diagram. Now, this is actually considered it as a heart, okay? Here are the blood vessels supplying the blood to the heart, named as coronary arteries. Now, these coronary arteries are responsible to supply blood to the heart. What happens with the passage of time due to some factors inside these blood vessels? The blood vessels that are supplying the blood to the heart, okay? In these blood vessels, in the coronary arteries, plaque formation takes place. You can say an obstacle is actually formed here to the blood flow. If there is no obstacle, the blood will flow in a very simple and easy way. If here comes an obstacle, what will happen then? Then the blood flow will be reduced. Due to which, what will happen? Very simple. If the blood flow to the muscles of the heart is reduced, we call that a condition is reduced in the supply of oxygen to the heart. So if the heart is not receiving oxygen, then the heart will not function well. What will happen? Its metabolism will change. In the meanwhile, if metabolism is changing here, there are some factors like pyruvate and lactic acid produced. Those factors, pyruvate and lactic acid, they are responsible to cause pain in the heart. That pain is actually known as angina. Okay. Now, what was the main factor here? And what is the main factor here? That is obstacle formation, known as plaque formation. When this plaque formation takes place, this will cause reduction in the blood flow to the heart, to the myocyte, cardiac myocytes. So now if cardiac cells are not receiving enough oxygen, metabolism will be disturbed. At the end, there will be the synthesis of lactic acid and pyruvic acid and etc. etc. That will all lead towards the pain. So then painful sensation will be observed. Now these painful sensation observed because of what? Because of decrease in blood supply. We can say in short, because of decrease in the supply of oxygen. So here, if we are talking about in the heart, decrease in supply of our blood, by that we actually mean decrease in supply of oxygen. So you can use both the terms. Decrease in supply of our blood is equal to decrease in supply of oxygen. So if the heart is not receiving oxygen, the heart will then pain, in short, in simple words, okay? Now this pain is actually known as angina. Now let's come towards the atherosclerosis. Remember, some of the students, they mix athero with the arteriosclerosis. Concentrate here. Here we have athero, not artero. Artero is actually the hardening of the artery. Now athero, here it is actually the plaque formation in the coronary arteries, okay? So now this plaque formation, how it is caused, now let's discuss this in a very simple and easy way. We know that the blood vessel, now this coronary artery has got three important layers: tunica, adventitia, media, and intima. Three layers. Then this layer is actually covered by endothelial lining. What happens in some cases, this endothelial lining is actually eroded, removed. Now, if it is removed, then the floating LDL will find this free space. That floating LDL then will diffuse into the intima. Now, as this LDL reaches the intima, in the meanwhile, there will be monocytes traveling here in the blood. They will also come and will diffuse into the intima. Now here is the enter, they will become macrophages, LDL will become oxidized. Now these macrophages and oxidized LDL, they will interact. How? Like macrophages will start eating these LDL. And then these macrophages will be named as foam cells. Now these foam cells are responsible to do further complications, okay? They will call more here collagen, smooth muscles cells. So like this, they will cause proliferation of the smooth muscle cells from the media, tunica media, from the second layer. So here smooth muscle cells are coming. In the meanwhile, here we're having LDL, macrophages, T cells. So these will actually form the fatty streaks, okay? And foam cells, along with all these, they will help in the synthesis of the plaque heart structure. So now what will happen? Slowly and gradually, this particular structure will bulge out. Now this bulging will result in the plaque formation. This bulge may remain the same, and this may rupture. If it ruptures, then that condition is named as what? Actually, thrombus formation will take place here. Then this may move also along with the blood pressure. If the blood pressure is increased, this may move also with that. There are some other complications also. In short, here what is happening? Accumulation, plaque formation is happening all here. With the passage of time, its size will increase. So as it is increasing with the time, it will cause decreasing in the diameter of the blood vessel. So if the diameter of the blood vessel is decreasing, that will result into decrease in supply of the oxygen to the heart, to the cardiac myocyte. And again, if the heart is not receiving oxygen, what will happen? Metabolism will be changed and painful sensations will be observed. Those painful sensations are actually known as what? Angina, anginal pain, chest pain, in simple words. So what happened here in short, let's summarize this all. LDL got a free space here because there was no endothelium. Then though that LDL entered, it was then oxidized in the intima. Then here the monocytes were traveling also in the blood, that also diffused in. They became macrophages. Then those macrophages phagocytosed the oxidized LDL. They became the foam cells. Those foam cells were much reactive, much active. They then caused the proliferation of the smooth muscle cells of the media. Along with that, here the LDL macrophages and some other T cells, when they were summing up together, they were synthesizing the fatty streaks. Now these fatty streaks plus all these collagen and smooth muscles, they will sum up together, they will add up together, and they will result into the plaque formation. So that's it all about the plaque formation and plaque synthesis. So this plaque is responsible to decrease the blood supply, and this plaque, with the passage of time, it may rupture. That will then form thrombus formation, and this will then occlude the entire blood vessel. Or if there is no thrombus in formation, there is just the formation of thrombus, and this formation is actually a kind moved within the blood vessel when it is this coronary arteries. So that is then called as embolism. So all those cases, they will lead towards myocardial ischemia. That ischemia will then, if prolonged, if not treated, will move towards infarction, and at the end, what will happen? Heart attack may lead to death. Okay, that also. So this is all about the etiology, pathophysiology of the angina, or the atherosclerosis in short.